As you know, I guess my name is Gogs Gagnon. I was diagnosed with prostate cancer when I was 57 years old. That was back in 2017. Now, at the time, I was quite healthy and fit, and I had no symptoms of any kind, and I had no health issues. So it was quite a shock, and it was quite devastating to hear the word cancer. It actually all started about 5 years earlier. Once I turned about 50, my doctor recommended that I have regular checkups, physicals, head to toe. And I figured, sure, that sounds like a good idea. I was fit. I wanted to make sure I was healthy. So I started having annual physicals. And at one of my physicals, the doctor recommended that I have a PSA test. Now, at the time, I didn't know anything about it. I knew I had blood tests. I knew they were looking for cholesterol levels and all these, a whole bunch of terms. And I figured, well, PSA is just another value to measure. Why not? We'll throw that in there too. And so off I went with my requisition to the lab. I got my blood work. About a week later, I was back in the office, and the doctor was quite happy with all my blood work. Everything was really good, all within normal range, except for my PSA was slightly elevated. Now, he wasn't too concerned. He says, you're only your first reading, and why don't we just read it again in 3 months? In the meantime, he gave me a digital rectal exam, and he said everything felt smooth and normal. Perhaps my prostate was enlarged at the time. Can you hear me? It says I'm muted. Oh. He said my prostate was enlarged, but that's kind of typical as men age, so he wasn't really concerned. And he said, well, let's just read your PSA in another 3 months. So I wasn't worried about it, and I thought, okay, I'll do it again in 3 months. So 3 months later, my PSA was even higher. Again, my doctor wasn't too concerned. He says, well, there's many reasons why your PSA might be high. He said recent sexual activity might be one, and I thought, well, that must be it, of course. So he recommended, well, why don't we do the PSA test again in 3 months and hold off on any sexual activity a few days before the test. And again, he did another digital rectal exam, and he said everything seems smooth and normal. So off I went 3 months later, another PSA test, and it was even higher. So now he was getting a little concerned. He said, well, maybe I should send you off to a urologist to see what they have to say about this. So about a month later, off to a urologist, and he asked me all kinds of questions, and I had no symptoms. I was sleeping through the night. I had no problems with urinary control. Everything was working just fine. He said, well, why don't we just do a PSA test again in another 3 months? So I said, okay. Another 3 months later, PSA is even higher. So he said, well, okay, why don't we do a prostate biopsy? Now, this is when you start to get a little concerned and you start to learn, because I didn't know anything at the time. And I didn't even know what a prostate biopsy was. So I went in, had my prostate biopsy, and it came back negative, no cancer. And I assumed that meant I had no cancer. But what I didn't realize at the time, and I only learned later, that prostate biopsy I had was just a random blind biopsy. And what the doctor does is take tissue samples from the prostate where cancer is most likely to be found, and no cancer. So I'm quite thankful my doctor recommended that I continue with the PSA testing, even though I had no symptoms, negative prostate biopsy. And he says, well, why don't we just take your PSA again in 6 months and we'll just see how it goes. Well, 6 months later, it's up higher. And as the years go by, 5 years, my PSA continues to rise every single time. I probably in 5 years had my PSA monitored at least 14 times. And by this time, 5 years later, my wife and I had moved. So we had to find new doctors. And so I made an appointment with a new doctor to have my regular annual checkup. And she was reviewing my charts. And she was quite concerned. She said, your PSA has been rising steadily for the last 5 years, and you've had a negative prostate biopsy. She recommended that I see a urologist and talk about that. So I did. I went to go see my new urologist. And he recommended, because I already had a prostate biopsy that was negative, he recommended that I have an MRI. Now, this is when I started to learn that the MRI, of course, gives you a nice three-dimensional image of your prostate that they can put up on the computer. They can turn it around, they can look at it, examine, look for anything unusual. So I went for my MRI, and the results came back as they found a significant, not just a little, but a significant anomaly. And it was in an area of the prostate that's out of reach of the digital rectal exam. Now that's something else I assumed, and I learned afterwards. When the doctor, gives me a digital rectal exam and tells me that my prostate is smooth and healthy, I assumed that he meant the entire prostate is smooth and healthy, but no, only the area that the doctor can examine was smooth and healthy. I didn't know that fact at the time. Now, I guess the good news about that is most cancer does start in that area where the doctor can feel. So it's still a valid test, and it will catch most cancers, but mine was out of reach. So this time, my new urologist recommended another prostate biopsy, but this time it wouldn't be blind or random. They would target that specific anomaly. And it totally made sense to me. And I'm thinking, wow, that probably if I had that MRI 5 years ago, they probably would have seen something, especially since it was significant. So that just means my cancer was just there for 5 years, growing, undetected. So I went for my second prostate biopsy, and of course, yeah, it came back as confirmed cancer. And they only took six samples, and 5 out of 6 came back as Gleason 4 + 3 = 7. Over 50% of the tissue that came back was cancer, and the tumor was large. The tumor was about the size of 2 golf balls, so that's when I got the devastating news that I had cancer. And when I was in the doctor's office or the urologist's office, and when he confirmed that I had cancer, once I heard that word cancer, I really shut down. As soon as he said cancer, I'm sure he kept talking, but I didn't hear anything. After he said cancer, that was it. I immediately went to the worst case scenario. I thought, this is it, my life's over, I'm a goner. And, it wasn't until later on, much later on, that I realized that I overreacted, of course, because probably my reaction was typical and maybe understandable. But for me to assume that life was over, I didn't even know my Gleason score at the time. I didn't know there was more tests involved. I didn't know that he wanted me to speak to a radiation oncologist, and there was just so much more work to do. How can I assume the worst? So, but what I discovered was when I was told I had cancer, I went into a shock, like I was in shock. And I didn't know I was in shock, but I was in shock. And what you really need is, when you're in shock, you really need time just to recover. So when someone says you have cancer, well, now you need time to recover and process that information. And while you're in that state of shock, it's not a good idea to make any decisions, especially life-altering decisions. So I immediately wanted surgery. Without really understanding that there's a whole host of other options out there. I just kind of wanted it out. My urologist, he didn't want me to make a decision. He said, no, we don't have enough information. We don't even know if your cancer is contained within the prostate, so we can't decide on surgery. And besides, there's so much more that we need to learn about it before we jump into a treatment. So I think subconsciously, or in the back of my mind, I've already made that decision, but I was open, or I thought I was open. And I did research a number of options, but I don't think I really assessed them fairly because I had it in the back of my mind that I was going for surgery anyway. But I really did explore a lot of different options. So it turned out that I went for my CT scan, bone scan, a few other tests, and they indicated that my cancer was contained. So I, back to my urologist, and I confirmed, yes, let's go for the surgery. And he really wanted me to see other doctors, and I thought, let's just go for the surgery. And so I went in for the surgery, and I was a little concerned about the side effects. Did a lot of reading, a lot of research on surgery. And the two most scary effects, of course, side effects, are urinary incontinence and erectile dysfunction. Those are the two top ones on my mind. So I talked in length, actually, with my urologist about that. And your prostate, there's actually these two bundle of nerves that run along each side of the prostate, and they're responsible for erections. And in the old days, when they did a prostatectomy, they would take out your prostate and the nerves and all the tissue around it, and then your erections were gone as well, at least naturally. But nowadays, they do attempt to spare those nerves, but the doctor's not able to determine that before the surgery, because the goal of the surgeon is, number one, remove cancer. Number two, maintain urinary control. And number three, maintain erections, in that order. So what that means is erections and urinary control will be sacrificed, if necessary, to get all the cancer out. So it really depends on, are the nerves healthy? Have they been invaded with cancer? Etc. So I took that risk, and I went in for my surgery, and I opted for an open prostatectomy. I could have went for the robotic, but I just went for the old-fashioned human hand touch. And the reason why I chose that is because I really had a really good rapport with my urologist. I really trusted him. And I would say, no matter what treatment option you go for, there's a lot of great viable options out there. But no matter which option you choose, you really ideally want to trust your team, your medical team, and have a good rapport with them, and because you're putting your life in their hands. So I really liked him and trusted him. So I went with the open prostatectomy, and here I am, waking up in the recovery room. I was alert, no pain, best sleep of my life. And of course, I'm very anxious to speak to the surgeon. And there he was. He came in to see how I was doing. And the first question I had for him, I didn't ask him, how did the surgery go? Was there any complications? Were you able to get all the cancer out? No, I didn't ask those questions. I asked, were you able to save my erection nerves? And of course, he laughed, and he said he gets that question all the time. And he said that he was able to save them. They were healthy. They looked good. But he warned me he had to manually peel them from the prostate, and they get traumatized, and they get bruised and damaged, and they may take months or years to recover, or there's a possibility, even though they're there, they may never work again. So that's the kind of, the news that I got. So I was happy they were there. And so basically I was in the hospital just for 2 nights. I had the catheter in for 2 weeks. Normally it's only like between 7 and 10 days, but for me, 14 days. I had a lot of trouble with the catheter. Most men don't have any problem at all with the catheter, but for me, it was painful. And it was so painful that I'm so thankful that there was a nurse in the hospital, because I was having so much pain with this catheter. She knew what to do, and it was wonderful, because she says, I know what to do, I'll be right back. And she ran out, and she came back with this tube of numbing jelly. And you put that on, and within a few, 30 seconds or something, pain's gone. Oh, so needless to say that no matter where I traveled with this catheter, I had that tube in my pocket just to relieve that pain. But most people don't have that problem, so it just was a problem. And also too, I think I overexerted myself, and I really did too much too soon, because there was this one time I was trying to get back into walking, and because I was very fit and I wanted to get back into doing things, and you really need at least 6 weeks or so to recover. And so what had happened is I'm walking and I actually fainted. I was very lucky that my son was with me. He was able to catch me before I hit the ground, and so I ended up having to go to my wife called the ambulance, and it was really a blur for me. I remember these two big muscular men coming in, really polite and asking me questions and taking my vital signs, and they took me to the hospital, and I just overexerted myself. And so again, you really need to listen to the doctor's advice. I mean, if you go, whatever, it doesn't matter what treatment you go for, whatever their advice is as far as recovery goes. I mean, you're going through some treatment, you need some time to recover. So had the catheter, and other than, once the pain was gone with the numbing cream, it was quite nice actually, because you didn't really have to get up and be drinking or whatever. But I was quite concerned when it came time to visit the urologist to get the catheter removed. Certainly on my mind, how much of a problem leakage would be. And now I did a lot of Kegel. I'm not sure if I'm saying that word right, Kegel exercises. I did a lot before, because I did a lot of research before, tried to strengthen my pelvic floor muscles as much as possible. Because what I learned is in men, in the male anatomy, there's actually 3 valves that control urine. There's the prostate, it clamps down on the urethra, but there's also the internal and external sphincter, they clamp down as well. So, normally we have 3 clamps holding down pretty good control. When you have your prostate removed, even in the best case scenario, 2 of those valves are removed and you're only left with 1. And that one is, on its own to struggle. So it may not be strong enough to clamp down by itself. So you do these Kegel exercises to help strengthen that muscle and all the other muscles around that area. So I did a lot of that, and so I was really hoping. I didn't know how effective it was, because I wouldn't know until the catheter was removed. So here I am in the doctor's office. He deflates the balloon that holds it into the bladder, and he pulls it out, and you can't help but look. I mean, you got to look, and how bad is it? And I was lying on the table, and there was no leakage at all. I think maybe because I was lying down. But when I sat up, I had some leakage. But I've been extremely lucky in that area, and it's very important to know that not everyone's going to experience the same outcome. What may work for one man certainly may not work for another. But I was very fortunate with the control. I was able to, it was within 6 weeks, I had my control back, and I don't leak at all, like nothing. And my flow is actually a lot better. I didn't realize, you see, I mentioned before that I didn't have any symptoms, but maybe looking back, maybe I did. Maybe my flow over the years was starting to slow over the years so slowly that I didn't really notice. And maybe I just thought it was normal aging. Because my flow is a lot better now, and I think, I guess maybe that was some kind of a sign that I didn't recognize at the time. So very happy with the urinary control. Now on the erection side, that's a lot more of a challenge, of course. Now, before you go into treatment, whatever treatment may be, depending on how good your erections are before, well, they're not going to be better after treatment, and probably worse. My erections are back, but it took, they're not like they were before, and they're certainly not as spontaneous as they were before. Before, it didn't take any effort at all. It's just basically on command, but now it may or may not be there. So I'm happy the cancer's gone, but still, it's not the same. But there. So I guess now I'm 39 months out. I originally had my PSA tested every 3 months after the surgery. Each time it's been undetectable, and now after 2-3 years, I'm now every 6 months. And then I think the standard is after 5 years, then it's every year after that. I'm not sure I'm comfortable with every year. I'm thinking every 6 months, but we'll see how it goes. I just hate, recurrence is on my mind, and it shouldn't be really, but I just, it happens. Even though the odds may be low, it's still there. So I have to try to stay on the more positive side of things, thinking, well, what if I had my PSA test today and it came back undetectable, and then one day later it started to creep up, and then a whole year goes by before my next test. So I shouldn't think like that. But I think we all kind of might think like that sometimes. But so overall, I'm happy with my decision, but at the same time, I'm not happy with my decision. Like, even though I don't even feel like I've had surgery, I feel really good, healthy. But even though it worked for me, I'm still not happy with the way I decided, because I didn't really fairly, as I pointed out, look at the other options. And I would like, the position I would have rather have been in is knowing that I fairly assessed every single option that was available to me, and fairly assessed the risks and the side effects, and then made the decision. Then, only then, if my treatment of choice failed, I would at least know that I did my diligence of researching all those different options. Because I didn't really do that, if my surgery would have failed, then I would have regretted it a whole much more than because I didn't do that homework. So we really need to do that homework. And I understand what it's like to get a cancer diagnosis. And I understand that we may want to go ahead with treatment, but we really need to take time first to recover from the initial shock of being told we have cancer. And we need to be able to process it, learn to accept it, and then be open to the options, and speak with more than one doctor, and speak with other people who've gone through it before you. And just, you really, it's a big decision. I mean, it's a life-altering decision. And something that I did was I've had a lot of time to reflect, and there were so many opportunities that I missed. And one of them was to speak with a nurse navigator. One of them was to join a support group much sooner in the process. If I had to go through this again, I would join a support group even before making a decision. Because what I've learned is, like most men, I guess I'm typical, is we grow up in a male environment where we're supposed to be tough. We're supposed to be able to solve our own problems and not show our emotions. And so a lot of men, they'll go through it alone, and then only after their treatment they'll join a support group. So I think before, I mean, it's hard to reach out. It's hard to admit that we need help, but it's the right thing to do. And that's the one thing I did when I wrote the book, is I had no plans to write a book. I had no plans to even talk about this. When I was first diagnosed, I just wanted to curl up in a ball and just hide. I didn't even want to talk to my wife about it, but I was very lucky to have a good support from her, and she was able to encourage me to speak. And I realized that when I talk about it, it's helpful and therapeutic and healing. So I just started to write a journal at first, and it was a private journal. I had no plans to share it with anyone. What had happened was I had a lot of friends and coworkers who would call and ask how I was doing. And so I decided just to share some of the private journals with them, and they encouraged me to keep writing. And then I decided, well, maybe I'll write a book, but I had no idea what I was getting into, because it's a huge undertaking. But one thing I wanted to be sure was, if I was going to go through the effort of writing a book, it had to be completely uncensored, and it had to be a complete experience. And I wanted to make sure that I put in what I would do differently throughout the book. So there's probably at least 30 things that I would do differently if I had to go through this again. Which with some of my videos I highlight. I have a top 10 list that I read off, just like Johnny Carson used to do. If I had to do my treatment over again, what's the top 10? And I list my top 10 that I would do differently. I've met a lot of men who've rushed into treatment, and you know, I hate to say it, but some of them have regretted it. And as I say, even though my treatment was successful, and I'm not doing that bad as far as side effects, I certainly would have regretted it, like, immensely if it failed, because I did not take that time to do my homework. And at least I'd be in that position to know that if my treatment failed, well, I did everything I could to make the best decision I could for me. And then I would at least be able to take comfort in that, even though the treatment failed. Important to understand not only all the different treatment options, but as you say, what are all the different possible side effects? And even with the radical prostatectomy, the two you really only hear about are the urinary incontinence and the erectile dysfunction. But there's a whole list more that they don't speak of, or you don't hear about. And one of them is penis shrinkage. And it's a possible side effect, and you need to question it and learn more about it, and you need to know what you're going in for. And then at least you can accept it. If it happens. I've been lucky, but every case is so different. But you need to know what you're up against before you go in there. Ideally, you don't want to make a choice and just say, well, I hope it works. So it's a pleasure to be here and be able to share, what I've learned, and just be here. I'm so happy and thankful. So I hope that I could help make a difference to men and their families, and as you say, we need to be more open and upfront. And I think for me, it was very difficult to join a support group. I didn't want to go. I didn't want to be in a group of men. I didn't want people to feel sorry for me. I didn't want people patting me on the back or anything. It was tough. But when I went there, it was not what I expected. It was just a bunch of great guys sitting around chatting, and nobody has on their tough face, because when I was growing up, everyone's Mr. Tough Guy, and you never admit if you're in pain or anything. And seeing other men just speak openly and non-judgmental, it really made me comfortable to know that it's okay to be vulnerable. It's okay to cry. It was a wonderful experience, and that's one of the things that I definitely would do. Number one is join a support group as soon as I was diagnosed, before decision, it really helps you realize that you're not alone, and you don't have to go through this alone. As a man, we pretend to be tough, but we're really not. But that covers me basically to where I am today. And so how's it going?